Well, hello there, everyone. You show you right here talk about for co-payments, and basically if we talk about like for co-pay, and you see right here is these right here will be pictures right here I wouldn't put together right here, but talking about is like have right here is like for me when so, as like if I'm growing up and as well as my early childhood, picture it is, and this picture right here, if I can remember right, was taken, I think, back before, it was before I was started kindergarten, like most of us can remember, from the Gold Monument it is, as well as, for, little brother careers. But, you see right here is that, talks about for co-payments. And I know that, if anybody were warned, or that, yeah, if you go to the doctor or maybe the dentist or, if it's anything based on like an agreement, from the insurance company or some sort, and or maybe if you want to pick up a job or something like that, and then like warrant where like at the co-pay, and some that may warrant where what exactly does that mean necessarily, and so I say that yeah, that's what you call the out-of-pocket expenses, and if you're like warrant where that why is it that like warrant where whenever you go to a doctor or maybe pick up any prescription drug medications or anything like that, or any type of medications that you would likely have a co-payment. And with this co-payment, it could be between $8, maybe $5, or maybe $20 at the most. And if you're picking up any antibiotics or anything like that, over the counter, like it's like any type, any medicines that likely you'll need to have, especially related to like that, prescription, like if it's anything related to the doctor's note or anything like that. And so you're like wondering to where that what exactly is co-payment. And I know besides if you were to be getting sick though that like it could be like maybe for company reasons also. So let's say that the co-payment was about up to about maybe $14, and some might say as to anything that you might need to have for whenever you're starting a job, especially if there could be maybe some co-payments on top of that, such as money that you need to provide right there and then it's possible you'll be reimbursed later on, but still that if you like weren't, or yeah, go to a doctor or anywhere that you got to take care of, and thinking is to where that not everything is going to be paid for by the insurance or anything maybe related to like a coupon or so. So you're like warrant or that like a co-payment. So if we like warrant or yeah, whenever you go up to the pharmacy or maybe anywhere and maybe going to to take care of something and thinking about it to where maybe not everything is going to be free right away, and it's possible they may say yeah that you'll be reimbursed for any of it, for any expenses that you might come up with later on. But you see right here, I talk about for $14, and $14 to some that may like think as to where they yeah that $14, $14. I would say right on average is to where even if you have insurance that maybe not all the cost of maybe the including the antibiotic that you need, including the cost of the doctor's visit, and as well as the tests that they ran, especially that they may say that you got a co-payment of some sort. And I know, like with most insurance plans, would explain about as to where that for what the co-payment would be, as to where that if it's going to be for in-network or out-of-networking clinics or so, but any labs, but anyway, any doctor's care center, but they would explain about the co-payment especially. So, so I know, like with most doctors, though, is to where they would say is to where that yeah that before the charges come in, to where that they would charge you a certain amount to just for going to the doctor, especially on your insurance. But then they may say that you got a co-payment up about that 15%. So you're like worried to where that yeah, going to the doctor and thinking necessarily to where that well it's I thought maybe the insurance paid for that, but you have right here like for co-payment, and if we want to look at it as maybe like like a settlement or like an agreement, to where that like warrant to where that we may have been used to for many years but you're buying a snack or maybe a drink from the cafeteria, especially at the school. So you're like warranted. Whenever you go to school, especially since the 5th and 6th grade, that you're like warranted, that you don't have to worry about have any money with you, or like sometimes to where that you're like warranted. Yeah, there's been a few times that I have forgotten my lunch money, and you're like warranted. Anybody like warranted? Get something in the cafeteria, and you need a little bit extra money, just to get it. But still, that for any type of meals, such as if it's snacks or anything like that, since we were about maybe since I was about this age here, I'm like, did I remember that? How old was I whenever I first bought my first candy bar or so, and thinking about it to where that, yeah, if you're gonna, whenever you're a kid, that you think about it to where that, the first few things that you may have bought with a little extra, maybe a few sources of change, or maybe if it's going to be maybe a few dollars that you were able to save up. But and I know, like with any kids that may say it's an ice cream. You buy an ice cream from an ice cream truck. It's like, yeah, the ice cream during that time, that it would only be about maybe $7.50 it would cost, for one of those, what you call the ice creams, ice cream cones that they would have off the ice cream truck, ice cream sandwiches or anything like that. I know a lot of times would buy the ice cream sandwiches, they were about $4 or $5 or something like that for a box of those. But I would probably say that, if anything, if I say that, yeah, about how old were you whenever you first bought something, and think about it to where that number of those times of, based on from your experience buying something from the store, or maybe buying something from the ice cream truck or so, and you go to the doctor and thinking whenever a child turns over the age of 18, they're going to go to the doctor's appointments, and they tell them about their co-payments. It's like, this is the price that you more likely got to come up with. The insurance is only going to be able to agree to pay this amount or so. And so I know a lot of times, anybody that may say that it's really, a lot of times it's no problem. And anybody that may warrant, or yeah, no problem basically means is to where you'll be able to take care of it. There's no problem to where that there's no. And I know sometimes that they say it's easier said than done, as to where no problem. And then by the time it's like a problem occurs, and knowing about how to handle that. And the best thing I can really say is try to handle it as best as you can. Like if there's a problem, and try to work out as best as you can also. But really, the way we think about this right here, I'm talking about for copay. And like with me right here, I would be over the age of 18 right here in this picture. So if anybody were worried to where that you would have maybe like a co-payment. But some that may think that this is not fair, because that with co-payments, co-payments are not just $14 each and every time. And I know that that you may come into a situation to where that there may be like an eye exam. If you go to the eye doctor and they examine your eyes, sometimes those co-payments, especially on your insurance, may not be paid for by the insurance. So you're talking about up to $50. It is sometimes for some of those co-payments. And some that may say that seems to be not fair, because you would think that the insurance company would be able to take care of that. And I know, especially for like car insurance, that you're like warranted to where they think about one co-payment. That if I know, like with anybody, in case if you're in an accident, or maybe if there's a reason to why anything going on with your insurance plan. I know, like insurance premiums, especially if you've been a safe driver for a certain amount of time also. So that's just a thing about co-payments, though. But if we want to call a deductible, and that's another word too. It's like talk about for a deductible. It's basically like an agreement. But I guess you say is to where that usually that occurs whenever you're in an accident. If you're in an accident, then that's basically about the cost of the amount that from the property damage, anything they calculate, especially. But you see right here is that these two pictures right here, these examples right here, of whenever I was young and then growing up here, and since getting my driver's license especially, and anybody that may warrant to where that yeah, that you would think that maybe everything would be paid for automatically, but really that I guess I don't know. If I could really say if I really want to argue with a matter other than is to where to try to get it done. Anything that you gotta get done, try to get it done. But I'm like, yeah, if it's anything about doctor's visit or a thing about car insurance or anything like that, X-rays that they may have taken, maybe at another lab that you may be charged a little bit. It's like even if you have insurance, but the highest premium I say that I have paid since that yeah that especially if it was going to a doctor or especially if it's going to the eye doctors, especially like the eye clinics that that they don't really charge. It's like that yeah for the you say the frames, but would be included like all for the insurance, but the eye exams. So that's just a thing that some that may say that not all insurance companies would pay for that. So that would be like say mean a co-payment on you. And I guess that a lot of times what I usually ask them is to where that they take Visa, because that if you go to a place and then find out that they don't take the payments that you would have, just to be able to pay the co-payment fee, and a lot of times that they kind of put you on a spot to where that yeah that but still that whenever you go to the doctors and thinking as to where that there's going to be a co-payment. So I know like with anybody that they may warrant to where that why is it that co-payments are pretty much commonly required. And sometimes with the insurance though that the insurance may agree at some points to where that oh yeah we'll be able to pay for this, or we'll be able to we'll be able to reimburse you for the cost of this or cost. And I know for whatever reason, this kind of reminds me of like maybe like the full coverage on auto insurance. So if anybody were warranted toward it, yeah, that if that's what you call it, really like a co-payment or some, but I know sometimes what they say is that usually that that a lot of things are paid for, especially if you got full coverage. But here's the thing that they may tell you is to where that you got to pay for it first before that you're reimbursed, and sometimes it takes about up to 10 to 11 days or something like that. Maybe a full week, something like that. Maybe about 5 days, something like that. The insurance companies that like will reimburse you for the cost of the tow, and as well as for anything else that's related to anything about the car or so. But so that's just the thing about for co-payments, and basically that if anybody wants to, where does it mean stand for like for company payments, or that it's like anything excluding, as to where the insurance company will be able to pay for this minus what you call on top of this. So basically that if anybody wants to, where you go to a doctor, especially with me though, that whenever my parents took me to the doctor, and especially going to the doctor, to go into the doctor's visit on my own, and they're like warned to her that yeah, you go to the doctor and they check you out and think about as to where anything is like, and that's just the thing. Anybody that may warrant to where really nobody is very proud. Now, nobody feels proud whenever they get a bill, especially if the bill is going to be maybe about $100, maybe 57, or maybe if you got a co-payment of about maybe $14 at the most. So you're like warranted to her, like with anybody, that whenever you go to the doctors, that really that I don't know if getting a bill in the mail is really something to be proud of. But one thing that maybe I could say, one thing I could know is to where that yeah that thing is to where that yeah, whenever you get a bill, that may not mean is to where that yeah that's money that you got to come up with necessarily. I guess it's kind of keeping you updated. And I know that I mean that's just the thing about me, is to where that I guess one thing that I do feel proud of is being able to see a lot of this stuff, because back whenever I was young, I used to always wonder to where to try to understand it a little bit better, that about just kind of check the background, knowing about that where can I see the paperwork, like I've seen my grade report a number of times, but then knowing about what about the co-payments on your insurance plans. So you're like warranted to where that if any kids ever ask as to where that insurance, co-payments on maybe the insurance, as well as maybe anything that's related to like any other type of cost as well. So if any kids ever wonder to where you seen the grade book a number of times, your parents looked at your grade book, but didn't thinking about is to where that whenever you get a bill in the mail. But I know that the first bill, of course, was a telephone bill, but I wanted to where if you get a letter from the insurance company or maybe from the school or something like that, and they may tell you that you got a co-payment of about maybe $4, some eardrops that you had to use during this time, maybe maybe some ointment, or maybe if you had to go to a doctor just for a checkup, or anything else that they would maybe say is that you gotta come up with a co-payment of a certain amount. So that basically means is to where out-of-pocket expense. And some that may think is to where that's not fair because the insurance company, but still that I don't know. I guess according to what they calculate is to where the insurance company that they pay for, like we say, certain amount also, and when I think about it, is to where that any letters that you may get in the mail, especially that some of that is from your insurance company, and they may say that it's not a bill, it's just basically about updated information. And some of those papers that we may get electronically or on file or in the mail, paper mail, that they likely stay is to where that this is to keep you informed about the doctor, and as well as the clinic, and as about any information they may have on their records. So they're like worried to where that for any kids, if they go to if they get sick and have to go to the doctor, and then they get a form in the mail or some sort, and they see that form, and they kind of see as to where that there's a co-payment. And I don't know if any child has offered to pay for part of their co-payment. Let's just say the parents will say is to where that the kid that went to the doctor over a tummy ache, or maybe they gotten the flu or something like that, and they were willing to pay about maybe $2 and maybe a few dimes and nickels or something like that. So anybody that may want to, or really like anything about whenever we're kids, we want to try to help our parents out a number of ways. One of those will be like getting a job whenever we're a certain age also. But then think about it as to where I may not always been what you call a smart or genius about keeping my stuff organized, as well as counting, doing the mathematical type count, long division tables and subtraction and additional problems. But on your hand, that when we go to the doctor, especially, I tell them about problems I trying learn, especially, and like with anybody that if you're going to have a co-payment, and let's just say that co-payment may not be much, but at least that they say is to where you don't have to what you call do too much of the math of the adding and subtracting and additional points or anything like that. But let's just say if you did, I'm like have something online to where there's a chart that you can follow to where that if you're dealing with about maybe up to about maybe $300 worth of a medical bill, like if there was x-rays that were done, or maybe a blood work that was done due to your health condition, if maybe about a little over $300 or $400 worth of expenses, the insurance company is willing to pay for a certain amount, but then you may have to come up with about maybe a $57 co-payment, or if anything maybe about maybe $43, or maybe $37, or maybe $14 or something like that. So co-payments, I guess, basically mean is to where that from how much you're willing to work, based on if you work, and then as well as for the check for how much that you make, it's like per every 2 weeks or maybe each month or so. So that's just the thing that like with anybody that like understanding about how co-payments work, and I guess some that may think as to where does that mean is to where that what's the rest of what's owed, and then that the insurance it says is to where that basically about the agreement is to where if it's like a settlement to where that they are willing to pay for this amount, and if you'll be willing from like your behalf from your visit and then from the doctor, and as well especially from the medical lab, that it's like ask if you will be willing to pay that part, so that portion of the payments. So So I know that with anybody that they may say is to where that co-payments, they may not be required each and every time, but really that yeah, I guess I could probably say is to where that really that you know, for anything that you're doing is to where that you know, it may not be, but still, I guess if anybody were to ask as to where that why would anybody feel proud, you know, just to be able to get a bill in the mail or maybe any type of paperwork in the mail based on their medical records or anything like that, you know, from the visit. And I usually think about it as to where just, you know, making sure that everything's updated, because I know with me though that I only go to a doctor maybe once a year at the most, and so that's why that some kids back whenever they were young that think about as to where they mainly go to a doctor whenever they get sick, but whenever they go to a doctor, maybe to meet the new doctor, or if it was anything related to like what you call like that they you know, you're concerned about your health or matters. So I know a lot of the paperwork from back about, you know, from the past, you know, 5 years or so, did they, you know, check on your health wise and you know, about your disability also. So I know like with any doctors that they would be concerned about that also. So I mean, that's just a thing that especially when you're filing your taxes, that you know, and I know that nowadays with most states is to where you have to have health insurance, at least you buy what you call a certain company, and they likely weren't to where you know, for every American child, you know, every child living here in America or you know elsewhere, that you need to have insurance. So it's like, think about it to where that we may think this to where that yeah, that you know, whenever you're going to be younger and thinking is to where that you don't quite understand all this stuff, but you have right here, this was right here was me whenever I was young and thinking about it to where, yeah, if I were to actually do my homework, actually, and thinking about the doctor's name and then you know, the insurance plan number and all that stuff, and be able to provide that, you know, to the nurses, and thinking about it to where, yeah, you know, anything that making sure everything's all up to date. So I know that co-payments may not always be what you call, they may not always seem like they're very fair, but then on your hand, that I guess you could say is that really that you try to make it affordable to you. That you know, those co-payments can be expensive at times, but then it's like working out to where that, yeah, that you know, they'll go ahead and take, you know, some that may even take, you know, it's like cash or check, or it's like money order, or if it's going to be, you know, anything about your visas. So if anybody were warned or that, yeah, you go to the eye doctor, and a lot of times that, you know, take a eye exam, or you know, maybe get blood work done, and I know that some that may say that yeah, you know, blood work done, blood work, that it's possible that if anybody were to say that they had a co-payment of about maybe $400 that they had to come up with, you just make payments on it. But anyway, but there you have it. I talk about, see, for co-payment, what is basically what co-payment basically means. It's like for co-pay. But all right, that made me 25, and thanks for watching. Have a great